counseling will follow the gather technique and starts with greeting the patient.
Now, Angelina, I think we should talk about a more reliable method of family planning so that you will have your children when you want them. Okay. Is that okay with you?
Yeah, that would be very good, Sister Tembe, because I don't really want to get pregnant again like this.
Right. And I would like to reassure you that everything which we talk about in this clinic is confidential.
Mm-hmm.
Okay. And I will have to ask you a few questions about your personal life and also if you have any medical conditions in order to decide which is the best method for you.
Okay, that's okay, Sister. Mm-hmm. The second stage of the gather approach is to ask the patient about themselves.
Firstly, I would like to ask you about yourself and about any medical conditions. Is that okay?
That's okay, Sister.
Can I just confirm, how old are you?
I'm 17, Sister.
Okay, have you used any family planning methods before?
I have. I used the pill, but I only used it for about 2 months because it made me feel very sick and it also gave me headaches. Okay. And then also my boyfriend and I tried to use condoms, but sometimes we forgot, and that's how I got pregnant this time.
Okay, you have mentioned headaches, but do you have any other medical problems as well?
No, Sister.
So pills may not have been appropriate for you because they caused you to feel sick and you had those headaches. And also condoms alone are not the best, especially when you used to forget them.
The third stage in the gather approach is to tell the patient about the appropriate methods of family planning available to her.
Angelina, I would like to tell you about 2 more methods or more reliable methods of family planning which you could consider. I have the IUCD, which I'll show you a picture of here. Simply, it will be introduced at the time of the abortion if you agree to do that. It's a plastic device with copper wound around it, which is introduced into the womb, and it will work immediately after. We do have another method as well, which is more also as reliable, which is the implant.
Okay.
The implant is introduced under the skin. Only you can feel it, but no one else can see it, so you can still wear your t-shirts and your short sleeves without any problems. It also works very reliably and can work up to 3 years.
Okay.
Without any problems. But obviously it can be changed. If you are not happy with that, we can take it out. Okay. It is easily reversible. The 2 methods which we have discussed will protect you against pregnancy. But I always advise people to also consider using condoms because those ones will protect you against sexually transmitted infections and HIV.
Okay, thank you, Sister.
I just wanted to make you aware that there are other methods. You could have the injection.
No, I think the IUCD sounds like a good idea.
Okay.
So if I decide to go with that, when could I have it?
The IUCD, you will be able to have it immediately after the abortion.
And then when do I need to come for checkups?
The checkup will be at 6 weeks afterwards.
So you mentioned that it would last for like 12 years.
Yes.
What if I want to have a baby before the 12 years are up?
It does last for up to 12 years, but if you are unhappy or there is any problems or you would like to have a baby, it can be removed and you will be able to have a child immediately after. Okay. So it's really reversible.
Okay. The fourth part of the gather approach is to help the patient to choose a method. Ask her which method she'd like to use.
Have you discussed family planning with your boyfriend?
Yes, I have discussed it and he would like me to try and use a much more reliable method.
Okay. Have you decided which method you would like to have?
I think I'll go for the IUCD.
You are happy with the IUCD?
I am, thank you.
Oh, that is lovely. I'll put it in your notes so that on the day of the abortion, on Friday, everything will be ready and it will be done immediately after.
Okay, thank you. Once the patient has chosen a method, the fifth part of the gather approach is to explain how to use the method.
Now, let me explain in greater detail what will happen on the day. At the end of the abortion procedure, it will take only a minute or two to pop in the IUCD at the end of the procedure. Occasionally, it may fall out, so keep an eye on that. And if it falls out, you are no longer protected, so you need to come back immediately. And the other issue sometimes is it may cause the periods to be heavier than normal. That usually settles within a few months.
Okay.
All right.
The final stage of the gather approach is to explain to the patient that she will be offered a return visit for follow-up and that she can return if she has any problems or concerns about the family planning method chosen.
Do you have any other questions, Angeline?
No, sister. I'm just glad that the IUCD can be fitted after the procedure and also that I can come back if there are any problems.
Lovely. So we do recommend that after 6 weeks, you come back for a checkup because we need to make sure everything is still all right.
Okay, sister, I'll do that.
Okay. Here is a leaflet where you can have more information about the method and prepare any more questions when you come for the final procedure.
Okay, yes,
All
sister.
right.
Thank you. Thank you very much. Thank you. In summary, post-abortion family planning counseling can follow the 6 steps of GATHER: greet, ask, tell, help, explain, and return.